Hello, my name is Alexis Casas. I'm the registered dietitian here at the facility. May I ask who I'm speaking with today?
Micah Joseph Alicea.
Hi, nice to meet you, Micah. The purpose of why I'm here today is to perform a nutrition-focused physical assessment, which looks at any potential muscle loss, fat loss, micronutrient deficiencies, or if an individual is at risk of malnutrition. Is it okay if I perform this nutrition-focused physical assessment on you?
Yes.
Great, thank you. So we are going to start from the top of the body to the bottom. I will also be looking at both the right and the left side, just to take into any account if there are changes shown on one particular side that's not shown on the other side. This may not be due to any type of deficiency, but just rather how the body is formed. Before I proceed, I did wash my hands and perform proper hygiene and sanitizing procedures. Some individuals may also wear gloves before performing the assessment. But first, what I'm going to look at is I'm going to look at your hair. So what I'm looking for is I'm going to observe the overall color and the texture of your hair, and everything is looking good. I'm also looking for any potential patches or see if any hair is missing. Is it okay if I pluck a little bit of your hair?
Yes.
Okay. So as I'm kind of gently going through the hair, I don't see any hair falling out. Have you had any experience with hair loss?
No.
Have you taken any medications that may impact you from losing your hair?
No.
Okay. Does your hair tend to shed easily, or does your hair tend to shed easily?
Mm-mm.
Okay, great. Everything is looking good. The color and the texture look great. Sometimes if an individual is having hair that's shedding, it could potentially be due to medications, or if an individual has thin hair, some potential deficiencies include vitamin A, E, biotin, zinc, or essential fatty acid deficiency. Hair that is easily broken or coiled could also be due to vitamin C, vitamin A, zinc, or copper deficiency, which is easily seen if the hair is in a corkscrew-like shape. So now I'm going to look at the eyes, and for the eyes I'm going to be looking at both the right and the left side. So what I'm looking for in the eyes is I'm observing the overall color to see if there's any paleness in the eye color, which I don't see. I'm also looking to see if there are any dry patches in the eye. So what I'm going to ask you is if you can use both your right and your left hand and just gently press down on your eyelids. And I don't see any dry patches. Dry patches could be a sign of vitamin A deficiency, but I don't see no dry patches. I will also observe if there are any cracks on the corners of the eyes, which I don't see. If there was, this could potentially be a sign of a B vitamin deficiency. So I'm just observing both sides. I don't see any cracks. Everything looks good. And as far as the color of the eye, if there was any potential paleness, this could be due to anemia, B12, iron deficiency, or folate. So now we're going to observe the orbital fat pads. And the purpose of looking at the orbital fat pads is to see if there's any muscle wasting, which can be seen if there's any hollowness or dark spots below the orbital fat pads. So what I'm going to do is I'm just going to gently palpate on both the right and the left side. And I don't feel any muscle wasting. I don't feel any hollowness. I don't see any dark spots. The color looks really good. And now we're going to look at the temporal bone. So again, I'm going to look at the right and the left side, see if there's any hollowness there or anything that may seem sunken in. Everything looks good. Now I'm going to go to the left side. Everything looks nice and healthy. And now we're going to do the oral exam. So we're going to look at the oral cavity. The areas of the mouth that will be assessed include the mouth, teeth, tongue, and the lips. I'm going to ask you if you would be able to make a fish face. You go like this. Okay. Everything looks good on this side. Now I'm just going to do this side. Okay, everything is good. And then what about a puffy face? Could you make a puffy face? Okay. Everything looks good. Now I'm going to ask you if you can open your mouth. Go ahead and open. Okay, close. Okay, everything feels good there. He's able to push down with force. Now I'm going to ask you some questions about chewing and swallowing. Have you ever had any difficulty chewing or swallowing?
No.
Some patients may have dentures, so this is where this question would also be relevant because sometimes they may or may not have difficulty chewing with dentures. I am also going to look inside of the mouth to see if there's any dryness present, which could be a sign of dehydration. I'm just mostly checking to see if there's any moisture present in the mouth. So I'm just going to ask you if you could gently open your mouth so I can see. Okay, everything looks good. I don't see any dryness. It looks moist. And some potential, now I'm going to move on to the lips. So for the lips, I'm looking to see if there's any cracks on the side or paleness in color, which could be a sign of vitamin B2, B6, niacin, or iron deficiency. So I'm going to look on the right side to see if there's any cracks, and I don't see any cracks. And as I'm doing this, I'm just observing the overall color of the lips. I don't see any paleness. Now I'm going to look at the tongue. So for the tongue, I'm looking for any sores, inflammation, and looking at the color. So is it a beefy red? Does it have a lot of redness to it? Which could be a sign of folic acid or vitamin B12 deficiency. And some other potential vitamins of concern include niacin, B6, or iron. So I'm just going to ask if you could gently, pull your tongue out. You could stick it out. Okay. Ate a little bit of candy. So yeah, I don't see any redness or beefiness of the tongue. It looks nice and pink. So now that I observe the tongue, I'm going to look at the teeth, both on the right and the left side. So this patient does not have any dentures. I already asked about questions of chewing and swallowing, which he does have no difficulty. I'm also going to observe the enamel to see if there's any paleness present. So if you could do me a favor and smile for me. Okay, the enamel looks nice and pink, and I'm just observing the teeth. Everything looks good. I don't see any concerns. If there was paleness in the enamel, a certain deficiency that may be present is iron deficiency, but I don't see any paleness there. Have you ever had any experience with your gums bleeding?
No.
Okay. So with that, if he said yes, a potential sign of bleeding gums could be a vitamin C deficiency. So it's just important to observe the mouth thoroughly. Mm-hmm. So now we're going to kind of work our way down. We're going to look at the clavicle. So it's normal for some people for the clavicle to be slightly protruded, but it is important to ask these questions to the patient. So have you, throughout your lifetime, has your clavicle ever tended to protrude, or it just feels...
I don't even know where that's at, and I don't think so.
So the clavicle is right here. So sometimes a sign of muscle wasting could be if there's a very a deep hollow area, and right now, I mean, everything feels good. I don't see any of the clavicle protruding. I'm just going to go to the right side. Okay, and everything feels good here, no wasting. And now I'm going to look look at your acromion process, which is part of the shoulder. Some patients may have a little bit more bony shoulder than others, but that could also potentially be a sign of malnutrition. So what I'm going to do is I'm kind of just feeling both of the shoulders on the right side. I don't feel any bony prominences, and I'm going to the left side. And now we are going to, what I'm going to have you do is I'm going to have you extend out your arm. You can just extend one for now, and just kind of gently press against my hand. Okay, and I'm just going to feel back here by the scapula. I don't feel no wasting or hollowness. Everything feels good. Now I'm just going to switch to the other side. Okay, so I'm just kind of feeling around the scapula and just kind of the back area if I feel any bony iron is present and I don't. Okay, everything looks good there. So now what we're going to do is I'm gonna have you put your arm up in an L shape on one of your sides. So I'm gonna go to the right side and I'm gonna do this for both sides. So what I'm looking for is, I'm looking to see if there is any fat wasting here. So what I'm doing is I'm just kind of gently kind of moving my hands down towards this area, and I'm able to, you know, pinch a good amount of skin. And for some people, if I was not really able to pinch some of that skin, that could be a sign of fat wasting. So I don't see this on the right side. Now I'm going to check on the left side. So again, in an L shape, and I'm just going to gently move my fingers down. Okay, everything looks good here. And then I'm kind of just going to gently observe the tricep area to see if there's any wasting or if the muscle is protruding out, which I don't see. Everything looks good here, both on the right and the left side. So now I'm going to look at the hands and the nails. So I'm gently gonna observe the nails for color and shape. So if I could look at your right hand. So what I'm looking for is the overall color, the shape of the nails, looking to see if there are any ridges present, which could be a sign of protein energy malnutrition. I'm looking to see if there's any spoon-shaped nails. This may be a sign of iron deficiency anemia, or even a clubbing shape could have some blueness to the nail, which I don't see. And you could also look at capillary refill. So I'm just going to gently place both of my fingers against the nail, and everything looks good here. So now what I'm gonna do is I'm gonna go to the left side and I'm gonna do the same thing. So I'm just kind of gently observing the hand. The color of the skin looks good. Just looking at the nails, I don't see any clubbing. I don't see any spoon-shaped nails. Everything looks good here. I do just see a little bit of ridges a little bit, but after kind of knowing my patient, he is vegetarian and doesn't consume any meat. So that could be a potential sign of protein energy malnutrition. So now that we looked at the hands and the nails, I'm going to look at the skin. So as I look at the skin, I'm just kind of briefly inspecting the skin on both the left and the right side. And everything looks good. I'm also observing the hair. I don't see any corkscrew hair. Everything looks nice and straight. The color looks good. And I'm also kind of gently pressing on the skin to see if there's any signs of dehydration. And if the skin would take longer to pull back, that could be a sign of dehydration. But so far, everything looks nice and hydrated. The color looks really good. Okay. And also for the skin, a sign of essential fatty acid deficiency is flaky skin. So after observing the skin, I don't see any flakiness. Everything looks good. So now that I looked at the skin, I'm going to look at the ribs to see if there's any potential fat wasting. So I'm going to look, I'm going to look on the right and the left side and just kind of feel if anything feels hollow, if it feels that the ribs are protruding out, which I don't see. Now I'm going to go to the other side. Just kind of gently palpate around. Everything feels good. Okay, and now I'm going to look towards the lower body, which is the quads or thighs, and the calves, just to see if they're well developed, if there are any bony prominences. So I'm first going to look at the left thigh. So I'm just going to gently press to see if there is any wasting. And I see that the calves are well developed. I don't see any bony prominences. Now I'm going to go to the right side and do the same thing, kind of just gently feel around the quad and the thigh area and gently feel the calf. Everything feels good. And lastly, for any signs of edema, I'm just going to press on the lower ankles on the right and left side for about 5 seconds to see if there's any indentation in the skin. So I'm going to ask you to lift your right leg, and I'm just going to hold it for 5 seconds. I don't see any indentation of the skin. Now let's go to the left side. So I'm going to hold it for 5 seconds. Okay, I don't see any indentation. And now we're going to, I don't currently have a stethoscope, but a GI assessment could be done in certain circumstances just for listening for bowel sounds. This is to see whether or not the patient has a functioning bowel. It's important to listen for any sounds of air or squeaking. Any firmness in the stomach may show that the GI mobility is hypoactive. So what I'm going to have you do is just kind of sit back in the chair a little bit. And I don't have a stethoscope today, but I'm just going to gently press on the stomach. Everything feels good. I don't feel anything that is too firm in the stomach. And lastly, for the hand dynamometer, I don't have that as well, but this is used to analyze lean body mass. It's usually done by having the patient hold on to the hand dynamometer with an arm at a 90-degree angle and squeezing it as hard as they can for several seconds. And this is done about 3 times, and an average will be taken of that. And anything that's greater than a 25% difference from the standard deviations could be a sign of malnutrition. But in this certain scenario, we do not have a hand dynamometer today. But everything has been covered for the nutrition-focused physical assessment. I don't have any nutritional concerns at the moment, aside from seeing a little bit of ridging in the nail. But again, with this patient being vegetarian, it may be common to see a protein deficiency just because protein in the diet is fairly limited, but this could be replaced by some potential supplement or just eating more beans and legumes to increase protein intake. So now we have went over everything. Thank you so much for your time, Micah, and I hope you have a great day.
Thank you so much. You did great.
Thank you. Thank you.